Now let's talk about the next entity, which is cannabis-induced disorders. Now in cannabis-induced disorder, the first important topic which we're going to cover is cannabis-induced psychotic disorder. When I say important, again, they are important both in terms of practical aspects, because many times you will get patients who have consumed cannabis and they've come to you with psychotic symptoms. So it is one of the differential diagnoses. And in also, sometimes you have a case of, let us say, schizophrenia, and there is a history of cannabis intake. So many times you would keep cannabis-induced psychotic disorder as a differential diagnosis. And also in terms of your theory exam, sometimes a short note may be asked on this topic. So one should know important points about this. Now, usually when we talk about a psychotic disorder, it is not very common with the cannabis, and usually, as we've discussed, commonly transient paranoid ideations may be seen. But yes, sometimes psychotic symptoms may develop shortly after heavy cannabis use, and usually the symptoms would be persecuted delusions. So delusion of persecution may be seen along with other symptoms such as marked anxiety. Emotional lability, changes in the affect may also be seen. Depersonalization may be seen, and also hallucinations may also be seen, such as auditory visual hallucination. Now usually these symptoms, they would remit after a period of abstinence, and usually within a day they may remit, or sometimes they may persist even for few days. And if they continue for a long time, especially for more than a month, then one may think of independent psychotic disorder. Now it is also known as hemp insanity, especially in India. So it is also known as hemp insanity. In fact, in the West, there is still a debate about this diagnosis of cannabis-induced psychotic disorders because of many reasons. Because of variations of clinical features, because there is no specified criteria marked for this entity. And also there is no confirmed etiology. And there are not very much good studies for this entity. So again, there is a debate about the existence of this entity. But again, we have seen that patient may sometimes present with the cannabis-induced psychotic disorder. Patient has florid psychotic symptoms, and usually it is seen more common in countries where people have long-term access to high-potency cannabis. So that is why, again, in India, sometimes people have that access, and many times we see patients having this disorder. Now, in fact, it is seen that patients who come to you with cannabis-induced psychotic disorders, they may be affected with a pre-existing personality disorder, or that means there may be a pre-existing vulnerability to psychosis. So there may be already some vulnerability or risk factor, and a person consumes cannabis and may subsequently lead to psychotic disorders. Now, there is this evidence of cannabis and acute psychosis. It is basically the suggestive evidence for this causal relationship is through clinical case reports. So many times you will find certain case reports in which you will see patient had psychotic symptoms after cannabis use, and the symptom would go away after abstinence, and there is no previous history of any psychotic episode. So again, this is suggesting that it is likely a cannabis-induced psychotic disorder. And in fact, I would suggest, do read case reports during your residency. And if an opportunity comes, I would also suggest, you should try to write even or publish some of the interesting cases you have seen or observed during your residency. So yes, through case reports, we have seen cannabis-induced and acute psychosis may be seen. And also in experimental studies, such as, especially in the West, studies with the IV THC, it is seen that it can produce psychotic symptoms in whom there is no risk factor for a psychotic disorder. So that means, again, through this experimental studies, it is again shown that it can induce a psychotic disorder. Now let's talk about the DSM-5 criteria. So let's discuss what are the DSM-5 criteria for cannabis-induced psychotic disorder. Now this you will find when you read the topic of schizophrenia and other psychotic disorder. There you would find substance or medication-induced psychotic disorder. So criteria A is that there should be presence of one or both. One is a delusion, second is hallucination. So one or both of these should be present. And criteria B is that there should be evidence from history, physical examination or lab findings of both of the following. That symptoms developed during or soon after intoxication or withdrawal or taking cannabis, and cannabis is capable of producing these symptoms. Yes, it is suggestive that it is capable. So both should be fulfilled. Then criteria C, again very important, is we should try to rule out there a possibility of independent psychotic disorder. So criteria C is for that. So criteria C says that it should not be better explained by a psychotic disorder that is not substance or medication induced, that is cannabis induced. Now, such evidence of independent psychotic disorder could include, so let's try to understand what are the evidences which suggest that it may be an independent psychotic disorder rather than induced by cannabis. So one is, if the symptoms preceded the onset of substance use, that is cannabis use. So if the person comes to us, cannabis use, let us say, is since 1 year, but symptoms of the psychotic disorder has been present even before that. So that is suggesting that it is basically an independent disorder. Then B is that symptoms, they persisted for a substantial period of time. For example, at least 1 month after cessation of acute withdrawal or severe intoxication. So again, even after 1 month, the symptoms, they are continuing. Then again, one should think of independent psychotic disorder. Or third is, there is other evidence of independent non-substance medication induced psychotic disorder. So if there is other evidence that patient has independent psychotic disorder, for example, if there is any history of recurrent such episodes, so in the past, if the patient has recurrent psychotic disorders previously and they are not related with the cannabis, then again, it may suggest that it is an independent disorder. So generally, when you're making a diagnosis, one should try to rule out these which are suggesting or favoring independent psychotic disorder. So again, very important, whenever you are making a diagnosis, one should be aware. So these points would help you differentiate between induced versus independent disorders. Now, of course, criteria D is, it should not occur exclusively during the course of delirium, then we don't consider it as induced psychotic disorder. And lastly, it should cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So it should cause clinical distress or impairment in functioning. That is why we call it then another disorder. So these are the criteria of cannabis-induced psychotic disorder. Now let's discuss about the treatment. Now again, in treatment, usually we see that the symptoms usually go away after abstinence. So abstinence is important, and usually supportive care is one which is required. And sometimes patient may require antipsychotics, and usually when we give antipsychotic, we may prefer second generation antipsychotics such as quetiapine, which may be given in these patients. So this is about cannabis induced psychotic disorder. Now, since we are discussing this topic, let's also discuss cannabis and schizophrenia, a very important topic. And in fact, many times you may get in your exam a note on this cannabis and schizophrenia. So let's try to understand this. Now again, studies have shown that in fact there is a consistent epidemiological evidence of association between cannabis use, dependent cannabis use, and schizophrenia. So studies have shown that people who have a dependent pattern of cannabis use, they may develop schizophrenia. Now, in fact, longitudinal studies, they've shown that regular cannabis use can precipitate schizophrenia in a vulnerable person, or it is seen that it may exacerbate its symptoms who already have developed schizophrenia. So there is some sort of relationship which has been seen by some of the longitudinal studies which are done. Now, studies have shown that there is a dose-response relationship between frequency of cannabis use, early age of onset, and risk of developing psychotic disorder in the patient. So again, there is a dose-response relationship also being seen in some of the studies. Now let's talk about some of the important hypotheses which suggest this relationship between cannabis and schizophrenia. And many times when you are writing these hypotheses or knowing these hypotheses is important. The first, and in fact one of the more plausible hypothesis, which is now again being very effective or is very commonly discussed, is that cannabis is contributory cause of schizophrenia. That means it is one of the factors which increases the likelihood of developing schizophrenia. In fact, it is also sometimes termed as a component cause. That means along with other risk factors, it is one of the risk factors. So a person having certain other risk factors consumes cannabis, there is a likelihood that the person may develop schizophrenia. So this is one of the most important hypothesis of the relationship between cannabis and schizophrenia these days. Now, let's talk about, when we talk about it's a contributory cause, then there is also this hypothesis is biologically plausible. So let's try to understand. So we know in psychotic disorders, There is a disturbance in a dopamine neurotransmitter system. Again, when we discuss schizophrenia, we've discussed this in detail, that dopamine is one of the important neurotransmitter system which is affected. Now, it is seen that drugs which increase dopamine release, they cause psychotic symptoms. And again, it is seen that THC, it releases dopamine. So this again has been seen. And also in elderly patients who are on trial with cannabinoids for treatment of neuropathic pain, again it is seen that sometimes they may also develop psychotic symptoms. So again, these are suggesting that yes, cannabis may be associated with the abnormalities in dopamine system, which again can lead to psychotic disorders such as schizophrenia. Also, in the treatment, it is seen that antipsychotics, which we know decrease dopamine levels, they are seen to be effective. So this again suggests, so this is the biological plausible explanation to this hypothesis that cannabis is a contributory cause of schizophrenia. Then there are other hypotheses. One is that persons with schizophrenia may use cannabis as a form of self-medication, and many times to relieve themselves from distressing symptoms of schizophrenia. So it may be used as a self-medication. So that is also one of the hypotheses, and many times this hypothesis is for many of the psychiatric disorders. So one is this, it is used as self-medication, because we know cannabis may cause symptoms of euphoria, there is elation of mood, so they may use it. Now the next hypothesis is that cannabis use is a marker of either other psychotogenic drugs, example amphetamine. So we've talked about this. In fact, cannabis use can lead to use of other drugs such as amphetamine when we're talking about the gateway hypothesis. So that may be cause of schizophrenia, or there may be an increased genetic vulnerability to schizophrenia. So again, genetic overlap may be one of the hypotheses leading to cannabis use developing schizophrenia. So in fact, let's talk about one of the specific genes which has been identified in some studies. So in fact, one study, especially, it was done in New Zealand. So it was seen that this COMT gene, that is the catechol-O-methyltransferase gene. So this gene basically codes for this enzyme, and it is important for the breakdown of dopamine, especially in the prefrontal cortex. So again, you can see the importance of dopamine in the etiology. Now, it is seen that individuals may have valine position of the amino acid at 158 codon. So there may be valine homozygotes which have highest enzyme activity. Then some may have valine methionine heterozygotes may be there who have intermediate enzyme activity, while it is seen that those who have methionine homozygotes, they have the slowest enzyme activity. Now, it is seen that some individuals may have substitution of valine to methionine at 158 codon position, that is valine 158 met SNP, and this methionine to valine substitution may cause alterations in the enzyme activity. So this study which we are talking about done in New Zealand, it showed that individuals who had this valine or who were valine homozygotes, they had highest risk of developing psychotic symptoms after cannabis use, while those with met homozygotes, they had the lowest risk. So yes, it is seen that genetic polymorphism may increase psychotic symptoms if cannabis is used. So in fact, this COMT gene polymorphism is one of the first evidence of the gene and environmental interaction. That is, we have always talked about this stress diathesis model. So factors in the environment and genetic vulnerability may predispose a person to certain disorder. So this is one of the first evidence. Again, various other studies have been done. Some have shown this result, some have refuted this finding. So there is, yes, one evidence that there may be some predisposition, genetic predisposition. Now also, when we talk about, certain studies, so again, 35-year-old follow-up Swedish conscript study, it also showed that cannabis use, it precipitates schizophrenia who are vulnerable due to any personal history or family history of schizophrenia. So again, this is also suggesting that there may be a stress diathesis model. So there is a vulnerability, genetic predisposition is there, and if there is certain environmental factors such as cannabis, it can lead to schizophrenia. So again, this is the third hypothesis, and there are certain evidences towards this. So there is estimates of attributable risk which suggest that cannabis may play a role in approximately 1 of every 10 cases. So again, there is low attributable risk is seen with cannabis and schizophrenia. Now, when we talk about cannabis and schizophrenia, again, cannabis use can be considered as a risk factor. So again, it is seen that it is more of a risk factor towards schizophrenia and also a predictor of poor outcome in patients with schizophrenia. Again, this is important. Many times we see patients having schizophrenia may also have cannabis use. So it is seen that it is a predictor of poor outcome in terms of it increases rates of recurrence, increases the rates of relapse, and also more severe symptoms are seen when the person with schizophrenia uses cannabis. Also, cannabis use in schizophrenia also sometimes can lead to misdiagnosis. Many times you may be considering cannabis-induced psychotic disorder, which is like acute psychosis, not having that much of a poor prognosis as compared to schizophrenia. So sometimes it may lead to misdiagnosis, and it can also lead to delay in the treatment as well. So again, one should be aware about this cannabis use and schizophrenia relation. Now, role as a etiological factor, again, it remains uncertain. So this was about cannabis and schizophrenia. Again, an important topic. One should have a good understanding of this.